here tonight for our class. Heart health. If we were by, I've done this little exercise before with many of you, but just for the fun of it, so you guys can look around. How many of you here know somebody, either yourself or somebody you love and care about, that's been affected by heart disease? By show of hands. Right? Now I just want you to look around the room. Look around the room. Keep your hand up. Right? And that's pretty profound. If we had a room here today of 100 people, half of the people in the room will die from something that is related to heart disease. That's 50% of the people, right? So that's a pretty big number. So over the next, 45, 50 minutes together, I want to show you the most effective, the most natural way, the most powerful way to be healthy, to stay healthy, and, right, to make sure that you're steering away from this thing that nobody wants. Is nobody wants to have heart disease. However, 50% of the people, if there's a room of 100 people here, will die from heart disease, right? Which is very unfortunate. Some of you here tonight, maybe you've heard of some of those concepts before, and my question to you is like, okay, I've heard it before, what am I going to do with it, right? I think that's an important question. I'm assuming right now that's a big assumption, but if you didn't care about your health, I don't think you'd be here anyway. So if you do care about your health, that's what I'm starting with, is I'm thinking that if you do care, that's the reason why you're here. I want you to be asking yourself, hey, you know what? With this information maybe that I already know, what am I going to do with it? What's the next one step for me? Are you guys okay with that? Yep. Yes? Mm-hmm. Some of you here, or most of you, you know my story, but I just want to circle this back real quickly just to see how relevant that is, because I kind of have a passion for what I do. Matter of fact, I do have a passion, not kind of, I do for sure. Right? And I just want you to remember why I do, because if you've heard my story before, I'm just going to go quickly over that, but my dad passed away when I was 8 years old, and part of his story that I have seen in front of my eyes is by the time my father was 30 years old, he had peripheral neuropathy. And if you don't know what that is he could not feel his legs at all. You could literally take a knife and just jab him in his legs and start bleeding. He did not even know what was happening to him. So, in case you don't know that, peripheral neuropathy obviously has something to do with the cardiovascular system, right? So at a young age, he had, multiple chronic illnesses that led him to, to no longer be here, right? But that was like a turning point for me in my life when I was 8 years old, and that's the reason why, in front of you here today is because I don't wish that on anybody. And if there's anything that I can say, I'm probably not going to say anything that you don't already know. I'm probably just going to, put it in different, in different order, but when it's all said and done, you probably know everything, right? But I'm just hoping that I can impress upon you the things that needs to be done for you to make sure that you avoid that. Does that make sense? How many of you here write a good book at some point in time? How many of you? By show of hands, right? Am I the only one? How many of you here, that was a great book, great information, you intended to do something with the book, but you didn't do anything about it? It's going somewhere. Yes? Am I the only one? She's like, I'm not sure. Should I do it? Right? Of course, everybody's done that at some point. Right? I just want you to know that you only have one life, one race. Just don't waste it. Right? You only have one life. Don't waste your life. Don't waste your race. That's your race. So we don't want those books to collect us. If you get something that's like, you're like, hey, you know what? I got to do something with it. Just go ahead and do it. Don't waste any time. So I want to start by and when it's all said and done, I also want to give you a strategy that if you choose to, you'll be able to take action, right? To find out what your next step is. Because information with no action does not lead to transformation. I'm going to say this again. Information with no action does not lead to transformation. And my goal for you tonight is to be transformed by the time you leave, that there's something you're going to do about it. You guys okay with that? Are you okay with that? Same for you guys, wherever you're watching, okay? I want to start by showing you this. I was telling Dan, I said this heart beating there, that's pretty cool. I did not think that this would happen, but hopefully this is your heart that it's beating. You might not be seeing this here, but it says pharmacy versus health food store. You see those people here? They might not be, they don't look so happy. Versus those people, yes?
Yes.
Here's the carrot. You like carrots?
Yeah.
Okay, cool. Here it says, why do people have heart disease? Right? Some of you out there, you might think like, this is my gene that runs in my family. This is just bad luck, right? It's my culture. I'm old. It's normal. So here's what I want you to know tonight, and this is important. If you did not know that, you need to write it down. The biggest misconception that people have is people think that heart disease is genetic. And some of you have heard this before, is the only thing that runs in family is silliness. And what that means is, I usually have other words for it, but I'm going to try to keep it PG, right? The only thing that runs in family is silliness. And what that means is heart disease is not a gene problem, right? It's a lifestyle problem. If every generation makes the same, they make the same, they do this, they have the same action, they eat the same thing, they have the same lifestyle, the result's going to be the same. Okay, so heart disease is not a genetic problem, right? It's a lifestyle problem. Now, you should be really happy by now, because knowing that it's a lifestyle problem, that means there's something you can do about it if you choose to, right? And I'm going to give you tonight, we're going to be talking about those things that, if you have it, how you can, reverse it if you choose to, or doing the best that you can so you can turn that around. And if you don't have it, make sure that you don't have it by doing the things that needs to be done from a lifestyle perspective so it doesn't happen to you. It's not because something is common that it's normal. Does that make sense? When people say, well, Dr. Jean-Guy, I have normal headaches. Headaches are not normal. They're common, but they're not normal. Right? I want you to hear me right now. This is important. Headaches might be common, but they're not normal. Heart disease might be common in this country, but it doesn't mean it's normal. Right? So those are two different words, and you need to understand that. This next one here, it says, in this book, it says, Fat That Kills, 1993. It says, degenerative disease that involve fat prematurely kill over 2/3 of the people currently living in affluent industrialized nation. That's us. 68% of people die from 3 conditions only of fatty degeneration. One is cardiovascular disease, that's the highest. Cancer, 22%. Diabetes, 1.8. Now, this is back in 1993. I'm telling you, those numbers are higher today.
Yeah, different.
Right? So this is important. This is a lifestyle disease. It's not a genetic disease. On this next one here, it says those are the facts. Heart disease facts. 610,000 people die every year from heart disease. Right? Heart disease leading cause of death, both men and women. So lots of people, it's affected by a lot of people at some point in time, right? I mean, there's you here tonight, and we should probably have 300 people here, because guess what? It's affecting everybody. A lot of people that just want to go like this and say, you know what, it's not me, it's not going to happen to me. Guess what? It's going to happen. Right? It's going to happen. It's just a matter of time. Because of our lifestyle. If you adhere to the SAD diet, which is the standard American diet, for sure it's going to happen. It's just a matter of time. Right? So here it says, let's talk about symptoms. So we have this young lady here, Diana was asking me about AFib. This is a symptom. Cholesterol is a symptom. High blood pressure or low blood pressure is a symptom. Pulmonary hypertension is a symptom. Cardiomyopathy is a symptom. Chest pain, heart palpitation, shortness of breath, tired, headache, digestive issues, those are all symptoms. You follow me? Those are not diseases. Like sometimes people will come to me and say, Dr. Jean-Guy, I've got hypoglycemia. They think it's a disease. You can't get, you're like, I've had that all my life. Hypoglycemia is not a disease, it's a symptom. When you have hypoglycemia, that means your adrenals are weak. That means you're not nutritionally sound. That's why people have that. It's not a disease, right? When a person has hypoglycemia and you ask them not to eat for 4 or 5 hours, they think they're going to die, right? They're like, oh, I can't do that. I'm going to die. Like, no, you won't, okay? It's not going to happen. Hypoglycemia is a symptom. It's not a disease. When a person has high cholesterol, that's a symptom. It's not a disease, right? So the question that you want to be asking yourself is whatever symptoms you have as it relates to your heart, you want to be asking the question, well, why do I have that? Are you guys okay with that? Mm-hmm. You guys okay with that? Yes? 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 John says yes. He's like, I'm okay with that. Right? Why do I have those symptoms? If you have one of those, you want to ask the question, why do I have it? Those are not diseases, they're just symptoms. There's more. Hemorrhoids is the symptoms of cardiovascular stuff going on. Gums that are bleeding, cardiovascular. When you bruise easily, that's cardiovascular. when your veins are bulging out of your legs and you're like, oh yeah, my mother had that, everybody had that in my family. Yeah, this is not a genetic problem, it's a lifestyle problem. What's the next one here on the list? It says cracks in your earlobes. Do you have one of those? You've seen those in people? When you see those cracks, just like you see right here, do you see that? That's a sign. When you look on your fingernails, you're supposed to have this half moon. It's supposed to be white. As you start with your thumb, you're going to see the white half moon. As you're getting towards your pinky, you're going to see less and less. If you don't see this white thing starting with your thumb, getting to your pinky, right? That means that there's a problem with circulation. Right? That means there's a problem with circulation. So you guys are looking at your fingers, you're like, oh, I'm not looking. Where's my hands in my pocket? Those are signs. People don't go from being healthy to having cancer. People don't go from being healthy to having high blood pressure. People don't go from being healthy and then the following day they have AFib. That doesn't work that way. Right? There's a process. Does that make sense? There's a process. People don't go from being healthy one day and then the other day they have cancer. There's a process. So I want you to understand that. People don't go from any one of those symptoms that people have. It doesn't happen in one day. It's been a process. That's why I never want you to say ever again. Now listen to my words. This is really important. Every single day, people are on the table. I'm a chiropractor. Okay, I'm a little bit of a fan of chiropractic too, in case you didn't know. Right? So people are on the table and they would say something like, yeah, but I felt fine. Yeah, but the doctor's like, yeah, I felt good. I'm like, this is not how you feel, it's how you heal. Right? This is not how you feel, it's how you heal. Is that possible? A person can feel good and have a heart attack. Is that possible? Yeah, it happens all the time. I don't want you to just run your life by saying, I feel fine. Right? That would be the biggest mistake. Don't think you're healthy because you feel good. There's a lot of people out there that feel good, they just croak over. Yes? Mm-hmm. Yes? Right. Yes and amen. Okay, good. So, those are symptoms of people having heart issues. So, we go back here, you see this big list, and there's many more. Right? You see more there. And then, so here it says what's causing it. I want you to think outside the box. Really, I don't want you to think outside the box. I just want you to think about a person that is into health. Right? If you're into health, whatever symptoms you have, you're going to ask the question, why do I have? Okay, if a person has high blood pressure, you want to assume that, there's a reason for that. So you want to ask the question, why would I have high blood pressure? Why do I have tachycardia? If my heart is just coming out of my chest at night when I go to bed, there's probably a reason for it. Why is that? If you don't ask the right question, you're not going to get the right answer. High blood pressure is not a lack of beta blocker in your blood. Right? High blood pressure is not a lack of calcium blocker in your bloodstream. High blood pressure is not a lack of lisinopril in your kidneys. Right? Now, if you go see the doctor, that's what they're going to give you because they want to manage your numbers. And if your numbers look better, then they would call you what? They would say you're what? Better. Yeah, you're just healthy. Your numbers look good. You're stable. But let's say you take a blood pressure pill and it goes back down to 120/80. Is the problem still there then? Yeah, we haven't taken care of the problem, right? We want to find out what's causing the problem. Now, don't get me wrong here. If your blood pressure is 400/200, maybe you need to do something about it, temporarily, quickly. Yes? Does that make sense? Yes. Mm-hmm. But then after that, you need to be asking the health question, and the health question is always the same. It's like, why do I have that? Those are the things that we're going to discuss, because that's important. If you don't understand, if you don't ask the question why, you're not going to know. You're always going to be chasing what? You're going to chase what? Your what? Starts with an S. Your symptoms, right? My cholesterol is high, I'm going to get a pill for that. I can't sleep, I get a pill for that. I sleep too much, get a pill for that. I'm depressed, I get a pill for that. I'm anxious, I get a pill for that. I'm too happy, get a pill for that. Right? I can't poop, there's a pill for that too. You poop too much, there's a pill for that too. Right? I want you to think of this. I mean, you guys are laughing, but you're like, that's pretty silly. Guess what? People do that every day. They never ask the question twice. I'm assuming you're here because you want to be healthy, and then if you're watching there, right, if you're watching live, I'm assuming you're watching because you want to be healthy. At least if you don't want to be healthy, you shouldn't watch because I'm going to give you a strategy to be healthy. Right? Ask the right question and get the right answer. So the heart, you got to be thinking of three things about the heart. If we're specifically talking about the heart, it's all about rate, rhythm, and tone. Right? Two things have to do with nerve, which is, your heart is like an electrical conduction system. and then it's also a muscle, right? An electrical conductive system, and then it's also a muscle. So when a person has problems with, heart issues, then those are the questions that you want to be thinking, right? I want you to think of this here for a minute. We're going to take one concept. You guys ready? The heart is a pump. The heart is the pump. And then you have the entire cardiovascular system, all the arteries around your body. Yes? You follow me so far? And it's pumping oxygen into your body. And this pump there, all of this wiring, right? All of those arteries, let's pretend that they're made out of rubber. They're really made out of collagen, but let's pretend they're made out of rubber. Yes? You ready? And let's say that this pump here going to start pumping into this rubber hose, right, for the next 10, 15, 20, 30, 40 years. And let's pretend that this rubber hose, right, is made out of collagen. You follow me? Right? Let's say that if you have this amount of pressure running through rubber for 10, 15, 20, 30, 40 years, is that rubber going to become tighter or it's going to become looser over time?
Looser.
Right? Because if you have a certain amount of pressure, right, let's say for the next 40 years, this rubber is going to become looser. So if the rubber becomes looser, in order to keep the same tone, are you going to need less pressure or more pressure?
More pressure.
Yeah, you're going to need to have more pressure to keep the same tone. So guess what happens? If a person is not healthy, right, if they're not nutritionally sound and things are breaking down and this rubber hose is becoming more loose, guess what's going to happen to the pressure? Is the pressure going to go down or it's going to go up? Yeah, it's going to go up. So as you're getting older, right, if a person has been on the standard American diet, the SAD diet, SAD, S-A-D, and this rubber hose is becoming looser, right, then the pressure has to be higher to keep the same tone. So that's why when I see people that are a little bit older and wiser than I am, they're 60, 65, 70, if they've had any of the SAD diet during their life and they're not nutritionally sound, would I expect their blood pressure to be lower or to be higher?
Higher.
Yeah, to be higher. Right? And that would be completely normal. I wouldn't want to push it back down. If a person's blood pressure starts going up to 125, 130, 135, and then you start pushing it down with medication, guess what those people would say to you? They would say, I feel what? I feel lousy. I feel tired. Right? I feel sluggish. Because that would be normal. That's what the body's trying to do, because the body's trying to deal with the bad environment that you've created over the past 10, 20, 30, 40 years. Does that make sense?
Yes.
Yes?
Yes.
Okay. So now you understand that if a person is older and they've been on the SAD diet, the standard American diet, eating cake, cookies, candies, ice cream, bread, rice, and pasta for the past 10, 15, 20, 30, 40 years, guess what's going to happen? At some point in time, the blood pressure is going to go up and it's normal. Right? Now let's say that you're carrying, let's say for instance, you carry, right, an extra 10, 15, 20, 30 pounds. Okay, are you with me on this? Are you with me? Mm-hmm. Let's say you have 30 pounds more than what you should have, right? Now this 30 pounds, you think it's 30 pounds with nothing in there? If I were to just cut this 30 pound out, do you think that there's like vasculature in that 30 pounds of fat? Yeah, I want you to say yes.
Yeah.
If you nod your head and say yes, yeah. So if you have all this new wiring that you need to put in all this 30 pounds of fat, do you think that you're going to need to have less pressure or more pressure to get through that?
More.
Yeah. So do you think that maybe, okay, let's just pretend tonight that if a person were to have high blood pressure, do you think that if they were to lose weight going back towards their ideal body weight, that maybe they could have a chance to reduce their blood pressure? What do you think?
Yes. Yes.
I'm going to tell you here 100% of the time. It doesn't matter who you are. It doesn't matter what your name is. It doesn't matter what you believe. We've had a weight loss program in our office for the past 10 years. It used to be a franchise. Now it's a license agreement. It doesn't make any difference to you and me. I'm just telling you that I haven't taken one person, not one, over the past 10 years, putting them on the program and their blood pressure hasn't gone down in 10 days. Not one. And that's pretty simple. Right? I just want you to understand that the body is just adapting. Okay? High blood pressure is not a disease. The body is just adapting. You follow me? Mm-hmm. So far, so good? Yes or yes?
Yes.
Yes. Yes. Very good. That was the right answer. You guys are doing great. Okay. So it's all about rate, rhythm, and tone. I'm going to give you some more strategy in a little bit. So here's the stress and blood pressure. This is really interesting because, okay, I want you to pay attention to this. Some of you here, I mean, is there anybody here that's been under stress the past 15 months? Maybe the past 2 years? Maybe? Yes? Okay, let's talk about this here for a minute because this is really important. It's relevant to all of you here, including me. There is people, they go to the hospital right now, they see the cardiologist, they run every test you can imagine on the planet, every one of them. The nuclear test, the stress test, the EKG test, they run all the tests, right? They were fine, they were fine, they were fine. Guess what happened? One day, boom, they have a heart attack. That's that. I'm going to tell you how that happened. When a person is under stress, a person's sympathetic nervous system, that's your fight or flight, that's going to kick in. You follow me?
Mm-hmm.
The sympathetic nervous system, what it does is when it kicks in, right, what it does is it creates vasoconstriction of the arteries. So if you were to have vasoconstriction, meaning that we're going to narrow it down, so if you have blood and nutrient and oxygen going to your heart, and then I take the hose and then I shut it down, guess what's going to happen to the heart? Is it going to be happy?
No.
No! Right? So your sympathetic nervous system can do that, just like that. Right? Pretty cool stuff? Well, I guess that's not cool if you have one of those. But okay. So could a person be under stress and then maybe not having a heart attack but having their blood pressure up? Could that be possible? Yeah, happens all the time. Right? People go to Florida, they have their feet on the beach, they're like, boy, when I was there, they didn't have any symptoms, took my blood pressure every day, I was fine. And then they come back and guess what? Blood pressure goes up again. Right? Before I forget, I just want to give you, this is my clinical pearl. In 20 years I've done nutrition. Let me tell you this here, as it relates to blood pressure. When a person's blood pressure goes up and down, and they don't know why, it goes up and it goes down. It goes up and it goes down. They don't know why. Nobody knows. That's because you have problems with gluten, right? You have a food allergy. When people's blood pressure goes up and down, you have food allergies. That's what you have. It happens every time. If a person was to be off grain, off the gluten, the blood pressure goes right back down and it would not come up. Every single time, right? Okay? Overweight and blood pressure, we just talked about that, right? If there's a lot of routing, I'll answer a question in a minute, okay? If there's a lot of routing into the fat tissue, new arteries, right? New roads, we need to bring oxygen to those areas. We need to bring blood flow to those areas. So are we going to have to push less and push harder?
Harder.
You guys are all PhD, right? You guys see that? You're all smart people. Right? We just got to have common sense. Somebody explain it to you. I want to park myself here tonight just for a little bit because this is important. I want to tell you a little bit about cholesterol because this is so prevalent. Everybody should have this handout right here. You guys have it? Mm-hmm. Everybody should have it. Can you say yes? If you don't have it, you need to tell me, raise your hand. I would like you to look at that. I'm not expecting you to know this, but I want you to understand that there's science behind, beyond what I'm telling you. It doesn't just come out of my head, okay? I promise. I want you to look at this piece of paper. At the top it says the steroid hormones pathway. It says the adrenals, ovaries, testes, and peripheral tissues. So those pathways there at the top, it says some of the role of the steroid hormones. Okay, you guys ready? It says stress handling. Is that important?
Yes.
Reproduction. Is that important?
Okay.
Number 3, it says energy production. Is that important? Who would like to have better energy? How about blood sugar stabilization, right? And then here it says body repair, regeneration, anti-aging. Yes?
Yes.
And then on the right side, number 2, it says healthy brain function, mood, cognition. How many of you here, you don't need to raise your hand, you're like, oh, I'm losing it. I can't remember squat. I can't remember what I said 5 minutes ago, right? And then it says overall strength, stamina, vitality. Is that important? Is all this stuff important?
Yes.
Okay. Now what's the next word that you read there, that little square, that little rectangle? The top word, it says what?
Cholesterol.
It says cholesterol, right? Now cholesterol, which is if you go to, to go see your physician, and if your cholesterol is high these days, if it's more than 180 or so, right? Now remember, in 1984, normal cholesterol was 334. That was normal. Okay, today since it's above 180, then we want to give you one of those magic pills, yes? Now watch, are you ready? So from cholesterol, you make this hormone called DHEA. Anybody knows about DHEA? Anybody? Let's pretend that you don't, okay? Let's go down here, it says estrogen. Anybody knows about estrogen? Yes, you should. What about testosterone? Anybody knows about that? What about DHT? What about DHT? What about cortisol? If I were to ask any one of you here, tell me about hormones that the body produces when you're under stress. It's called what?
Cortisol.
It's called cortisol, right? And if you don't have that, you're going to die. So all of those hormones right here, progesterone, estrogen, DHEA, DHT, cortisol, pregnenolone, it's all made from cholesterol. So do you think cholesterol is important?
Yes.
Do you think that maybe if you don't have enough of that, your body cannot produce, you don't make those hormones properly? What do you think?
Probably.
Would that make sense?
Yes.
So do you think cholesterol is important?
Yes.
Do you think that if your cholesterol is higher than what it should be or what they think it should you be rushing to the doctor to get the magic pill to make sure that your cholesterol is back down to 100?
No.
Right? All those people that died every year, 600,000 of them, they were all taking their pill. They're all dead. Okay, you follow me? They were all taking their pill. Millions of them, they're taking their pills every year. They never missed. But yeah, they're still in their coffin. Yes?
Yes.
They're dead. Do you know how many people lose their brain, they lose their cognition when they start taking this pill? When you look into this book called, now listen to me here, this is going to be profound. We're getting closer. Right? It's called the Nutrient Depletion Handbook. It's being put out by the pharmaceutical company. And then in that book, it tells you that if you're taking cholesterol-reducing medication, it's going to decrease your cardiac output. It's going to shut down the production of CoQ10. Do you know what CoQ10 is? Many of you take it because you're like, well, when I take CoQ10, yeah, I feel better. Well, of course you do. CoQ10 is the powerhouse of the cells. And what happens is when you take those medications, it shuts down the production of CoQ10. Well, that's okay, you got a pill for that. Right? And there's many books that's been written about people that when they start taking the statin medication, one of the number one symptom is called rhabdomyolysis. What that means is your body, your muscle starts breaking down, so you start aching all over. That's okay. Got a pill for that too, right? We're going to give you some anti-inflammatory, but after that. People come to the office all the time, and I ask them, I'm like, well, are you taking any medication? Right? When people start aching all over, oftentimes the side effect is the cholesterol-reducing medication. That's what it does. Right? My question to you tonight, if I were to say to you, and you guys have heard this before, but I'm hoping you can just repeat those boring stories that I have for you, right? If there's an accident right here on Christ Road and the cops are there, would you conclude that's the cops' fault?
No.
No, you'd be like, you know what, the cops are there because they're there to help. Well, back in the days, decades ago, they've done this first heart study, what's called the Framingham Heart Study. You can look it up. Framingham Heart Study, the first study that was done, they wanted to find out why people had heart disease. And what they found out is when people had heart disease, they also correlated that people had high cholesterol. So from that moment on in time, they're like, hey, you know what, cholesterol is a bad guy. So from this moment on in time now, for decades, for several decades, they've been telling people cholesterol is a bad guy. So then everybody believes it, probably including many people in here. They're like, whoa, cholesterol is bad, my doctor said, right? But what happens if your cholesterol is not where it needs to be, then your body's going to have a hard time to do those things right there. And the function of those hormones has to do with all of those things. And all of you raised your hand. Yes? I saw it. Michael did. Everybody did in here. You all raised your hand. You're like, yeah. Energy, vitality, hormones, anti-aging, blood sugar metabolism, all of this stuff, this is what it does. So here's what it says. It says your cholesterol is going to be delivered to the adrenals, and then the ovaries, the testes, the peripheral tissues, via the low-density lipoprotein. So that's something else that you need to know, is the LDL, what they would be calling bad cholesterol in your blood test. Okay? Just a side note, if you're a believer, right, do you think that God made bad things and good things, or they're all good?
All good.
The Word says that everything is good. I mean, everything that He's done is good. So if you believe that everything is good, don't think that the LDL is a bad guy. The low-density lipoprotein, what they do is they deploy cholesterol places where there's inflammation. So it leaves your liver and it goes in the area where there's inflammation. So if the people that are taking care of fires, right? Somebody's calling, Michael has a fire in his house, and you're calling the firefighter, right? Now you need to have a taxi cab that's going to bring all those people over. That's the LDL. I would dare to say that Michael would be happy to see those people showing up on site if there's a fire in his house. Right?
Right.
That's what the LDL do. The low density lipoprotein, that's what they do. They're carrier, they're taxi cab. And then you have the HDL, they're the good cholesterol. I don't know where they got that from, but they think it's good, right? And the HDL, they take the cholesterol, they bring it back to your liver. So one's going to deploy out, and the other one's going to come back with. You follow me? The reason why they think it's bad is because when your LDLs are high, it just tells you that there's an underlying problem. Right? So if any one of you here were to come to the office and say, Dr. John, can you look at my blood test? Right? I would look at it and you'd be like, whoa, look at those LDL, they're really high. My doctor says it's bad. And I'm like, yeah, it is. However, my thinking and your thinking should be a little bit different. The question you should be asking is like, why would that be? I guarantee you 100%, any one of you here, even if I were to look at your lab test, if your LDLs are high, your cholesterol is going to be high because they work together. And if your cholesterol was to be high and your LDL was to be high, it would tell me that you have inflammation somewhere that we need to resolve. Do you follow me? LDL are not the bad guy, they're just doing their job. Right? If I say to you today, right, if I send any one of you out of Gilead and I say I want you to run 2 laps and you come back and I take your blood pressure, what would happen to it?
Go up.
Would you think it's bad?
No.
No, you'd be like, hey, that's good. The body did exactly what it was supposed to do. So before you say something is bad, you need to be thinking. When you have a symptom, it doesn't mean the symptom is bad. Your body is just adapting to the environment that you're putting your body through. Does that make sense? It doesn't matter what symptom that is. Okay? So this chart right here is really dear to me. And it's dear to me because if you understand, you're never going to say that this cholesterol thing is, you're going to think something's wrong with cholesterol. Right? Your body needs cholesterol, and every single cell of your body, they're made from cholesterol. This is how important that is. Right? So as it relates to heart disease and cholesterol-reducing medication, or your cholesterol being high thinking that you're going to die tomorrow, right? You have to ask the question, if my cholesterol is high, which question are you going to ask? Who can tell me? Yeah, Michael says, hey, I don't want to say, too loud because I don't want to steal the show here. But he said, I'm going to ask why. Okay, you guys are all smart. You want to ask the right question. The question is, why is that happening? Right? I have a fever. That's a symptom. You're going to ask a question. Why do I have it? Right? It doesn't mean you're sick. It just means your body is adapting to something that's going on the inside. That's what you want to find out. So that's what's happening here with cholesterol. I'm not going to bore you with this. It's a lot of fun, but you don't need to know that. Right? There is 70 to 100 trillion cells in your body. That's a lot of cells. Would you agree? When God made you, He made you when you're born. There's 9 trillion cells in your body, but as an adult, like all of you right now, there's anywhere between 70 to 100 trillion cells. And all those cells, they're all made out of fat. And one of those fat is called what?
Cholesterol.
So if it wasn't important, do you think that God would have made it? I don't know. Right? I'm just thinking to myself, I say self, I think that this must be important. Okay, so if cholesterol is important, then, I'm not telling you that you should not have wisdom. You need to be asking questions. The question is always the same as why? Okay? 70 trillion cells, pretty important. So those are some of the things as it relates to heart disease. Now we're going to get into the meat and potato. I'm not going to spend too much time on it, but I want you to understand in the world of food, we're going to talk about some of the no-nos. Okay, are you ready? So when we talk about the standard American diet, for sure, 100%, if you eat cake, cookies, candies, ice cream, bread, rice, and pasta, you're going to have heart disease. For sure. Okay, do I need to say this again? Probably some of you are going to dream about this tonight. Right? Cake, cookies, candies, ice cream, bread, rice, and pasta. That's what it does. The reason for that is because those things that I just said to you, they're either sugar or they break down in sugars. And anything that is sugar will cause more inflammation. If you have more inflammation, that's how people have heart disease. Right? If you start looking at the new literature of today, in 2021, in the medical journal, and you look at heart disease, it has to do everything to do with inflammation. So folks, I want you to just move forward here to 2021 and understand, if you hear the word heart disease, what are you thinking? Inflammation. So then you're like, okay, how do I handle that? Well, I need to stop eating cake, cookies, candies, ice cream, bread, rice, and pasta. Okay? If you want to have heart disease, then you eat cake, cookies, candies, bread, rice, and pasta.
Right.
Because those are the things that are either break down into sugar or they are sugar. That's pretty simple. Right? And then you have those bad boys right here. You see that? The trans fatty acid, back in the days when they were doing studies, because some of you might be really smart. And you might be like, oh, Dr. Jungi, fat is just like it says in the literature that it causes heart disease, and that's not true. When they did the Framingham heart study, and they did further studies, whenever they would do studies on fat, they would never separate it, right? God's fat versus man's fat. Trans fatty acid is a man-made fat. And what it does is when you eat this stuff, what it does to the cell membrane, this guy right here, it makes it real stiff. And when the cell membrane becomes stiff, then your body breaks down. Not only are you going to have heart disease, but you'll have diabetes, right? It's going to make you more prone to have cancer. It's going to make you more prone to have autoimmune disease, having issues with your immune system, and so on and so forth. You follow me? Can you say big yes?
Yes.
She didn't say yes. I'm waiting.
I said it.
She said it. Okay, so trans fat on the label, it comes under 3 different names. You should be an expert. If you read anything that has a label on it, you should make sure this is not on it. The FDA, I know some of you think that they have your back, okay? Just so you know, the chiropractors have your back. The FDA, I'm not sure. I'm just telling you that on the box now, they have lobbied a law that says that you can put 0 trans fat on the box, but on the label, when you read it, the trans fats are in there. As long as there's less than 500 milligrams per serving, they can still put it in. How's that sound? Criminal?
Yeah.
Maybe not. Okay. So those 3 names, hydrogenated oil, or partially hydrogenated, or fractionated, those are the 3 names that it comes under. If it's in there, you should try to avoid it the best you can. Right? Like your life would depend on it. Are you with me? That's in the world of food. Then you have the good fat. You have 3 different kinds: saturated, monounsaturated, polyunsaturated. They're all important. Okay, can you say that? They're all important. Can you say that?
Yes.
They're all important. Very good. Under polyunsaturated, you have the omega-6 and the omega-3. Can you say they're all important? Yeah, very good. The problem is when you eat the SAD diet, the Standard American diet, there's a lot more of the omega-6 than the omega-3. So as a result of that, it's causing what? It starts with an I. It's causing inflammation. And when you have inflammation, guess what the body does? Does the body repair or the body breaks down? The body breaks down, right? Just like some of you are like, oh, I get up in the morning, I can barely walk, my joints are hurting all over. I'm like, yeah, you're inflamed. Okay? You're not breaking down, you're just inflamed. Okay? Now some of you are like, oh, I have arthritis, everybody in my family have it. And I'm like, I'm sure you do. Okay? But it has nothing to do with that. It's because of your lifestyle. Okay? So fats are good. You should have lots of it. Butter should be dripping all over your face. Yes? Yes. Some of you are like, oh, I can't believe you said that. Hopefully it's recorded. It is. Maybe I should just stop talking like that. Here's the saturated fat. There's all kinds, right? So you have butter, cheese, if you don't have problems with dairy, coconut oil, palm oil, chicken, ducks, turkey, beef, lamb, eggs, dairy, you can't do that. Monounsaturated fat, avocados, almond, rapeseed, peanut oil, extra virgin olive oil, those are monounsaturated. Now, I don't want to spend much time on that. What I want you to know is all those fats are all important. Some of you here, you're just stuck on this one thing. And you don't need to, right? You need to have them all. When a mother is breastfeeding her child, most of what's coming out of the mom's breast is what? It's a saturated fat. It's those guys that they tell everybody in the world not to eat, right? There's a purpose to those guys. Matter of fact, here, right, this coconut oil thing, in case you don't know that, coconut oil is a medium-chain fatty acid. And what that means is, what's cool about this particular oil is it doesn't need any taxi cab in order to get into the cells and to give you energy. So a person can take coconut oil and they can stick it in the back of their throat. She's like, yuck. And then what happens is it gets right into your body and it gives you energy. Right? That's coconut oil. That's what it does. In some studies, it also says that, it will increase your metabolism. So some of you are like, oh, I'd like to lose a pound or 2. Well, start taking some coconut oil, right? So there's a lot of cool things that this type of oil does. It's called a medium-chain fatty acid. Matter of fact, there's a lot of synthetic of those that are being sold today. They're called MCT oil. Some of you have heard of them. You're like, oh yeah, I'm taking some special MCT oil. Listen, there's nothing special about MCT oil. Okay, God made that way before, the man people made them. It's called coconut oil, right? It's naturally occurring in food. MCT oil, medium-chain fatty acid. Okay. So, those are the guys here that we're trying to avoid, or we want to minimize. There's some omega-6 fat into nuts and seeds. You follow me? Now I want you to look at me here for a minute. There's some naturally occurring omega-6 fat in nuts and seeds. Those are good to go, right? But then you have those man-made oil where they're going to process them like corn oil and cottonseed and sunflower and peanut when they process it. And in the process of processing those oil, they're going to become bad. So when you're buying some of those oil and some of those fat, you want to be careful about, like, you know, it's cold pressed and, you know, it hasn't been processed. That's what you're looking for. Those are big names here over the omega-3 fatty acid, flaxseed, hemp, walnut. Those are plant-based omega-3 fat. Yes? You guys have heard of that? Plant-based. Plant-based. Then you have the other one, they're called EPA and DHA. That's where you find in fish oil. EPA and DHA. EPA and DHA. EPA and DHA. EPA and DHA. Okay. Here's the ratio that is acceptable, right? The ideal ratio of 6 to 3 is 1 to 1. The acceptable is 4 to 1. The most American are 25 to 1. And when they do studies on psychotropic people that have issues with schizophrenia, right? You're going to have 50 to 75 to 1 ratio. How's that sound? Matter of fact, this is really easy to do one of those spot tests. We have that at the office, like $50. You just take a little bit of blood there, you put one drop of your blood, they're going to send it into the lab, it's $50, it comes back, there's 7 pages. It's going to tell you about all the fat in your body. And it's going to give you the ratio as well. Sometimes it's scary, you might not want to see it. Right? If you've been on a sad diet for a while, you're like, ooh, that's going to be scary. You're going to see this number here, it's going to look like that. Right? 25 to 1, 50 to 1. So that means that your body's on fire, right? If your body's on fire, that means you're a walking heart attack. I don't want to scare you, I'm just telling you the truth, right? That's the reason why you wake up in the morning, you're hurting all over. That's the reason why people are like, oh, I think I have arthritis, my joints are hurting, Like, no, you don't have arthritis, you have inflammation. It's like taking a 5-gallon of gas, you put it in the fire. What do you think is going to happen? It's going to make a bigger fire. That's what's happening in the body, okay? Your body is not stupid. It's only adapting to the environment. Yes? She says yes. Okay, we're good. You guys are doing well. Okay, so I don't have time to go over this, but I'll take the time to go over this one thing. I did that last class. I want to do this one more time. Okay? Here's the omega-6. So let's say that you have a lot of those omega-6. When it breaks down, it's going to break down into this thing called prostaglandin E2. You don't need to remember that. You don't need to know any of it. I'm just telling you this prostaglandin E2. It's like the one that's a hormone, it's like putting gas in the fire. You follow me?
Okay.
Do you know how you activate that? You activate that with what? What is that called? Insulin. See where it says A for activation, insulin, but there's a little arrow. How do you activate insulin in your body?
Sugar.
Say it. Yeah, by eating cake, cookies, candies, ice cream, bread, rice, and pasta. Right? When you stop eating cake, cookies, candies, ice cream, bread, rice, and pasta, this guy here is like, you're not going to make a whole bunch of that. Okay, but our friends, the medical people, the pharmaceutical people, they're really smart, right? They are really smart, no doubt about it, saving lives, right? So they're going to give you those medications. They're called COX inhibitors. Have you ever heard of that?
Yeah.
Those COX inhibitors will prevent this guy here, arachidonic acid, to go into prostaglandin E2. So then you get up in the morning and then you can barely walk. You're all like, over like this. You're hurting all over. It takes you 2 hours to get going. And then you put your hands on the magic pill, right? You take Tylenol PM at night, or you take Aleve, or you take whatever you decide to take, and you're like, whoa, this is cheap, this works for me. Yeah, temporarily it works for you, just like anything. You can take a blood pressure pill, your blood pressure looks better, numbers look better, and the problem's still there. Does that make sense? You can take the pill as long as you want, you might feel better, you might sleep better, but you're killing yourself softly. Who wants that? Raise your hand. Okay, that was a trick question. Very good, you guys got it. Right? I mean, that's silly. Why would you do that? One time is not going to kill you. I'm just telling you, you do this night after night, that's going to happen. You're going to have a heart attack. Matter of fact, it's a side effect. Okay? Okay, we're almost done with that. Now, you see this here? It says I. I stands for inhibit. And then it says EPA. Do you know what EPA is?
Fish oil.
That's fish oil. Right? So when you take your fish oil, let's say that you take fish oil and you stop eating cake, cookies, candies, and ice cream. That's a winning combination. then you don't have to take a leave. You don't have to take Tylenol-PM, right? And then you're not going to have this bad guy right here at the bottom. You follow me? Can you say a big yes?
Yes.
Raise your hand at the same time, don't follow me, because I see some of you rolling your eyes. You know, it's not time. Well, I'm going to be done in 5 minutes. Okay, I'm going fast. I think you guys are doing good. I'm going to skip through this here. This gets really important because this has to do with vascular disease. So high blood pressure, heart disease, heart attack, all those stuff. Can you see that? Prostaglandin E2. Ready? Inflammation. So when I say prostaglandin, I want you to say inflammation. Are you ready? Prostaglandin.
Inflammation.
Very good. One more time. Prostaglandin.
Inflammation.
Excellent. Okay, those little arrow, when you have a lot of that, it causes what? Vascular disease. Who wants that? Anybody?
No.
Okay, very good. Here it says fibrosis. This is scar tissue. Anybody wants that?
No.
Very good. Here it says it will activate your sympathetic nervous system. That's your fight or flight.
Right.
So when you have a lot of inflammation, your body's stressed out. So sometimes people say to me, they're like, Dr. Jean-Guy, I really have nothing to be stressed about. And I'm like, I understand. However, if you eat cake, cookies, candies, ice cream, bread, rice, and pasta, your body is fully stressed out. You might not have anything in your environment that is stressing you out, but what you're putting in your body stresses your body out. Does that make sense? Okay, so the stress, when I use the term stress, I want you to understand stress can be what you perceive as stress, what you know stress is, right? She's sitting next to her husband, she's like, you're stressing me out, right? So now you know who's stressing you out, or, right, what your body perceives as stress. You follow me? Okay, so this is important. So it's going to activate your sympathetic nervous system. It's going to also create this degenerative disease. Who wants that, right? Lots of people have problems with their back. Why do they have problems with their back? Because when you eat cake, cookies, candies, ice cream, bread, rice, and pasta, and then on top of that, you know, you've been working your entire life doing the exact same thing over and over again. You follow me? Right? Some of you, you've been working at a desk for 8 hours a day for 40 years. Some of you have been driving your car hundreds of miles every single day for hours at a time for 40, 50 years. Right? You've done the exact same thing over and over again. On top of that, you've been eating a bunch of cake, cookies, candies, ice cream, bread, rice, and pasta. So this leads to what? Pain. Of course, you'll have lots of pain. Right? And then free radical is going to make you get old real fast. Yes? Yes. Did you have enough yet? Are you ready to go home? Right? You're like, wow, I'm sweating right now. I want to show you this next thing here, because this gets really exciting. It's exciting to me. Are you ready? So when the sympathetic nervous system, when your fight or flight gets, you know, activated, then guess what happens? It controls all of your organs, so what happens is it's going to make you more prone to have an infection, to have allergies, to have asthma, right? So how does that sound here as it relates to the past 15 months? Everybody's been a little bit concerned about COVID. I mean, you know, maybe just a little bit, okay? Some more than others. Yes? Okay? Maybe, right? If you stop eating garbage, that's going to help you out. And then here it says vasoconstriction. So what happens is it will vasoconstrict your arteries. If it vasoconstrict your arteries, that means that there's less oxygen, there's less nutrient going to your tissue. How's that sound? I'm going to come around you right now, and I'm going to take duct tape out, and I'm going to put it over your mouth and your nose, and I say, okay, just have fun. Right? You're like, no, that doesn't sound fun. Well, this is what's happening in the body. Right? When this is being activated, this is what's happening. And it's going to be, it will impair your genetic potential. Right? Meaning that you were meant for greatness, but now you can't be greatness anymore because, right, something will impair that. Okay. So the choices that you have is you can start eating better. So here it says, eat clean protein, right? Take your fish oil, decrease the omega-6 fat oil, the ones that are man-made, and you can also take your drugs that will inhibit the COX enzyme. So you do that before you go to bed at night, and then you feel good. You're like, oh, I sleep great if I take my pill. And it's cheap. It's over the counter. It only costs $1, right? So it's going to kill you softly. If you want that, then you do that. Those are all choices. They're not right. They're not wrong. I'm just telling you this is what happened, right? So when you take that model, here's what the model does. Right? If you take those COX enzymes, then it's going to potentially damage your gastrointestinal tract. It's going to make you bleed. It's going to ruin your kidney, and then you have chances of having breast cancer. Is there studies to prove that? The answer is yes. It's in the medical literature. Right? Or you can take Vioxx or Celebrex. You know, they just took them out because it was giving people heart attack and stroke. Or you can take Tylenol, then you get liver failure. It's good trade. You guys like it? Those are the side effects. People do that every day. They never question it. right? And again, here's what I want you to know. Are you ready? You might be thinking, well, Dr. Jean doesn't like pills. He doesn't like those drugs. No, it's not that I don't like them. If you do it one time, it's one thing. People do that their whole life. They never question it. They're like, you know what? It's over the counter. It's at the pharmacy. It's no big deal. I'm just telling you it is a big deal. If you read on the label, it says it's not done for people who do it for long term. Right? People do it every day. Here's what happened. The over-the-counter NSAIDs will kill 20,000 people. Prescription NSAID will kill 16,500. Total 36,500. Nobody talks about that. This is just like normal stuff to kill people. And we're cool with it. Right? Who wants to sign up for that program? Nobody wants that. Right? Unfortunately, this is happening every day. Nobody says anything. I tell people all the time. This lady one time, about 10 years ago, she's like, Dr. Jean, how many people have you killed doing this? I'm like, well, you could be the first one. Right? She's like, okay, just move on here. Right? So here's the alternative. Right? The alternative, I want to tell you this because most people don't know that. If you've been around, you do, because I always repeat myself. That's all I do for 20 years. I just say the same thing over and over again. Right? I'm hoping that, some people are going to get it, and I know that some people do. Right? But did you guys know that a chiropractic adjustment, when you do that on a person, what it will do to your sympathetic nervous system, to your fight or flight, are you ready? To your fight or flight, it will turn it off. It will inhibit your fight or flight. A chiropractic adjustment does that. Right? People look at me, they're like, really? It does that? I mean, I thought it was just for back pain. I'm like, yeah. Maybe we can help your back pain too, that's a side effect. But, a chiropractic adjustment, every single one that you get, it will turn off your sympathetic nervous system. Pretty cool?
Yeah.
Side effects, right? Okay. And then here it says you need more food because when you eat stuff that is man-made, what it does is causing what? Starts with an I?
Inflammation.
It's causing inflammation. Inflammation causes what to your cardiovascular system? Every single diseases that you can imagine, it will do it. From blood pressure to heart attack to, cardio, to anything that has to do with vascular nature. Right? And then here it says, you want to return to your ideal body weight. Why do we want that? Why do you want to work on that? If you have excess weight, what does that require from all your wiring? Are you going to have less wiring or more?
More wiring.
And then if you have more, you need more nutrient, you need more blood flow, you need more of everything. So guess what's going to happen? The pressure needs to be lower or higher?
Higher blood pressure.
Okay, very good. So if a person wants to be overweight and your blood pressure goes up, you don't want to be thinking that it's not normal. Your body is just trying to adapt to the environment to give your body what it needs. Now, I didn't say that a person could be 100 pounds overweight all their life. I'm just telling you that that's probably not good for them. I'm just telling you that if it happens, having high blood pressure would be normal. Right? If a lion comes out of the cage, starts chasing Michael, and then Michael says, Michael is feisty, he's not going to let the lion, touch him, he's going to start running, what would happen to his blood pressure?
Go up.
It would go up. Because you know what? He's like, this lion is not going to touch me. I'm going to run as fast as I can so he doesn't bite me. So that would be normal. I want you to understand what the body is trying to do. The body is always trying to heal itself first until it loses the ability to do that. Right? Because it's smart. And every one of you in here, you should know that. You should be like, my body is smart. Right? Okay. And then here it says decrease the omega-6 fat. And you want to increase the omega-3 fat. You can do that with your diet. So what that means is anything that is man-made, that is fried, anything that is trans fat, you can read that on the label. I've already made you an expert. Anything that, that those corn oil and all those vegetable oil, you should not have that anymore in your house. It should all be in the garbage, right? And then you want to increase your vegetables, all the green stuff. And the reason why you increase the green stuff is because green stuff is very cleansing. It's high in chlorophyll. It's very cleansing to the cardiovascular system, and it helps your liver, right? Those are antioxidant. And it decreases the inflammation. Yes or yes?
Yes.
Okay, very good. And then here it says increase your omega-3 fatty acids. So everybody here, if you're watching, or every one of you here, if you're not taking fish oil, you should be taking fish oil. Right? Now in the world of fish oil, I don't want to give you a long lecture. We could do that, but I don't have time. But there's a couple of things you need to look for. If you're taking fish oil, it's got to be pharmaceutical grade and or molecular distillate. Right? Now, they have this thing called the triglyceride backbone, which some of you, probably most of you, have no idea what I'm talking about. But the triglyceride backbone, what it means is the fish oil, when it was harvested, there's some companies out there that they're just master at manipulating and processing the oil. Most of them do that. So you're looking to have a triglyceride backbone, pharmaceutical grade, and or molecular distillate, right? That's what you'd be looking for. And some of you are like, never heard of it. I'm like, I don't have time to explain it to you. I'm just telling you what to do. Right? And all of you should be taking some every day for the rest of your life until you day you croak over. As simple as that, okay? The reason for that is because guess what? Fish oil, there's about like 5 million research paper on fish oil. You just can't go wrong, right? You can't go wrong. Fish oil is good for your eyes, it's good for your heart, it's good for your immune system, it's good for your joints, it's good for your cardiovascular system. You can't lose. You just can't, and you don't eat enough, right? Some of you are like, well, I eat like salmon once a week. I'm like, good for you, right? However, it's not enough. So you need a lot of it, okay? And then I'm going to talk about tests. Are you ready for the test? Because some of you really like tests, or you're all into the test, right? You're like, I want to see it. Show me the test. Here's the test. Are you ready?
Yeah.
If you want to know more, if you want to see an insight into what's happening in your body, you should probably write it down. Matter of fact, your regular doctor would do those tests, right? Most of them. This thing is called a high sensitivity CRP. It stands for C-reactive protein. So if there's inflammation, it's going to be high. It's called a high sensitivity C-reactive protein. The next test is called homocysteine. Homocysteine is related to B vitamins. I'm going to stop here right now. This is really important. Pay attention, folks. I'll write it down. I'm going to leave that slide there for a minute. You guys can write it down in a minute. Are you ready? Just look at me. I'll give you some time. I promise. She's trying to cheat. I'm watching you.
I'm a cheater.
Right? I know you guys. You're just like me. Just like, I'm going to write everything down. I'm not going to pay attention. Pay attention. Are you ready? Most of the heart condition that people have, if you have a heart condition, right? There's two things that you have to think of in terms of nutrient. You have to think of B vitamins, and you also have to think of minerals, right? Diane was telling about, AFib. AFib is a mineral problem. What happens is when you eat cake, cookies, candies, ice cream, red rice, and pasta, what your body does is your body, by the time it gets into your gut, all the B vitamins is going to be sucked out of your system, right? Because you're gonna be loaded with yeast, and yeast is going to suck all the B vitamins out of your system, right? And when you have a lot of sugar into your diet, what it does is your mineral ratio gets all off. So minerals and B vitamins are really important. When you don't have enough of those, then people have things like tachycardia. The heart is coming out of their chest, right? Or a person is going to have AFib, their heart goes out of rhythm, right? Because it has to do with mineral. Or people are going to have restless leg syndrome. Right? It's funny when people are like, oh, everybody in my family, they all have restless leg syndrome. It's a genetic problem. And I'm like, oh, if I can get your restless leg syndrome to go away, how much would you like me? Right? When people have problems with restless leg, that's a problem. That's a nutrition problem. It's not a genetic problem. It's not a family, an inherited of a bad gene. Everybody has restless leg. No. When you get up in the middle of the night and you got cramping in your legs, you got a nutrition problem. It's because you've been eating a sad diet. Right? You can fix that. Okay, so here, I know most of you wrote the whole thing because you just didn't believe me, but you were in a hurry to write all this down. This homocysteine thing has to do with B vitamins. Cholesterol profile, they're going to look at your LDL, HDL, all this good stuff. HA1C, it's hemoglobin A1C. They're going to look at your blood sugar over a period of 120 days. Right? That's what the HA1C is. Why is the HA1C better than just taking your blood sugar? Why is that better? Anybody? Anybody?
Why?
It tells you over time. So your red blood cells, they're going to live about 120 days or so, then they're going to be recycled into your spleen. So what happened is when they do an HA1C, right, when a person say, they're like, Dr. Jean, I've been really good. Really, 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 really good. And I'm like, oh, great. Just go get your blood test, give me an HA1C. Right? You can tell a story to all of your friends, but when the HA1C comes out, I guarantee you, right, this is going to tell you the truth. Right? If you've been eating crap, it's going to be right there. The HA1C should be below 6, should be below 5.6. I mean, ultimately, you'd like that. Not with metformin, not with every drug on the planet. It's like with no drug. That would be the goal, okay? If you're under 6 with metformin or any of the other glucophage or any other drugs that people take, this is not, it doesn't mean you're healthy. It just means we're managing your numbers, right? We're killing you softly. Who wants that program?
No.
Nobody, okay? I want you to hear me. This is important. So the HA1C, any one of you, I think your blood, your blood sugar tomorrow morning, that would be good. It gives us an indication. I have Michael doing it for two weeks, right? We're going to have an idea of how he's doing. But if you get an HA1C, it's more like it's going to give us a bigger span. Yes? We're good? You guys learning anything?
Yeah.
Yeah. Is the HA1C, is that the same thing as the A1C?
Yeah. Yes. And then the fasting blood glucose, and then the LPA stands for lipoprotein A. And then this is a marker, right, to tell you about inflammation. And then fibrinogen, which tells you about blood clotting. So when people will start talking about stroke, and people having issues with blood flow, right? They want you to take your aspirin for the rest of your life, right? Let's take a baby aspirin. Hey, if you want to take your baby aspirin, that's fine, be my guest. I'm just telling you here that if you're in the business of being healthy, then you would just do the things that's going to make you healthier. When you eat cake, cookies, candy, ice cream, bread, and pasta, right? And you don't have, the proper minerals into your body and the proper vitamins into your body, I mean, it's going to happen, right? It's going to happen. Stroke and heart attack, that's what happens to people most frequently, right? Make sense? It's going to happen. I mean, the writing is on the wall, right? Okay, those are the tests. Enough of this. Too complex, Dr. Jones. Let's move on. This is fish oil and heart health. We're going to move on. Fish oil, heart rate variability. Trans fatty acid, it says the effect on systemic inflammation. I don't think I finished my story earlier, so back in the days, when they would do studies on fat, they never separated saturated fat and trans fat. So there's many studies that says, hey, fat is bad. Fat is bad if it was man-made fat, right? You follow me?
Mm-hmm.
So sometimes when people talk about research, especially anybody on the news that says research shows, you should be turning off the TV, okay? They know nothing. They're just repeating stuff. They know nothing. They just read the abstract at best, or they heard it from somebody else. They know nothing, okay? Why would you listen to all this nonsense? They don't know anything. Research shows. This here, I just want to talk for a moment, because this is important. The FDA, they label vitamin C as ascorbic acid. The amount of vitamin C in a bottle is based on how much ascorbic acid there is in the bottle. So I want to warn you about that, because this is important. Right? If I say to any one of you here tonight, I'm going to give you an orange versus I give you a glass of orange juice, which one do you think is best for you?
Orange.
Right? All of you here, no exception, whether you know anything about nutrition, you'd be like, hey, you know what? No brainer. So what happens is when you take ascorbic acid is just the antioxidant part of vitamin C complex. So when you put that into your body, then your body is looking for the cofactor and the coenzyme. So vitamin C complex in nature is more than just ascorbic acid. You follow me?
Yes.
You have the bioflavonoid, you have vitamin P, vitamin J, vitamin K, tyrosinase, iron, copper, all this stuff is all part of vitamin C complex. So when you start dumping a bunch of ascorbic acid into your body, besides having diarrhea, I mean, I'm not sure, how much your body's looking for the coenzyme, the cofactor to activate it. You follow me? When it's not there, then the body's like, what are you doing to me? So I want you to understand that sometimes when you go to the store, even the health food store, right, you need to understand, what am I going there to buy, and what is that going to do? Right? Some of you, you're like, well, it's the health food store, everything must be good there. I'm like, hey, you know what? At the health food store, there's still crap, it's just more expensive crap. Right? That's the truth. I'm not telling you not to go to the health food store, I go to the health food store. I'm just telling you that there's still, they still market stuff for people to buy. And there's still a lot of stuff, probably half of what they have is bad. So you got to understand what you're buying, and then what is that going to be for, right? So remember that those rubber hose, right, they're made out of collagen. If your body doesn't have the right raw material, it cannot repair and it can't heal itself. Does that make sense? Yes?
Yes.
When you have have a sad diet, it's not going to happen. If you don't have the right raw material, it doesn't matter which pill you take, right? It doesn't matter how many aspirin you take. To think that this is going to prevent you from, from suffering and croaking over early, no, it's not going to prevent you. It's just killing you softly. Now, if that's the choice that you make, that's fine. But you need to know the truth about really what, this heart disease business is. It has to do with, the lifestyle that we're putting our body through that, the outcome is going to be that for sure. Okay? The B's and coal tar, in case you guys don't know, B vitamins are made out of coal tar. Most of the B vitamins are synthetic in nature. So when you have this big bottle of vitamins, because people bring me vitamins all the time, they're like, hey, can you look at this? I'm like, sure. Okay? And then it says vitamin B1, 5,000% of the RDA. Vitamin B2, 16,000 million of the RDA. Vitamin B3, 26,000 of the RDA. And they're like, I'm supposed to be impressed. Okay? I'm just telling you it's garbage. People think that they're just like, oh, this is the best. Of course, everybody has the best. Now, none of you has a PhD in nutrition. Matter of fact, I don't either. But I do believe that I have pretty good common sense. Okay? I'm going to share with you my common sense. You guys ready?
Yes.
Are you sure? This is the PhD about nutrition, right? B vitamins, right, in nature comes mainly from nutritional yeast. So you want to have the whole. The whole is always going to be more than just the parts. Would you agree? Yeah. So when people they man-made stuff in a bottle, and they give you those big numbers to impress you, because that's how they market it. They're like, oh, this is the best. Everybody has the best, yeah. Right? This is how they make B vitamins out of coal tar. How many of you want to have more of that? Right? That's how they make it. Why do they make it out of coal tar? Because it's cheap. B vitamins is really cheap. It costs like pennies to make. Right? Pennies. But you find B vitamins in liver. You find B vitamins in nutritional yeast. Right? The greatest source, one of the greatest sources of vitamin C comes from mushroom. People are like, yeah, mushroom, it's good for vitamin C. Right? I mean, you can eat your orange, you can eat mushroom too. Right? So you need to understand that you can find those vitamins and minerals into real food. Right? So when you read on the label that it comes from food, then you have a better chance that your body can use it, it can assimilate it, can do something with it. Yes? Yes. Now, I'm not opposed completely to a person taking some man-made stuff. When a person is so far gone, sometimes, there's some drastic things that's going to be done. But I just want to get you accustomed to the idea that the more food we put in, the more proper raw material we'll have, and the better chances we have for our body to heal itself. Yes?
Yes.
Does that make sense? Mm-hmm. She says yes. Okay, so we're good. High blood pressure. Taking medication is not good for blood pressure. That's basically pain medication. Here's the bottom line for the second time, just to make sure I forgot things the first time. Right? Less omega-6, that's inflammation. More of the omega-3 fat. The omega-6 are good, by the way, just so you know. I want to make sure I repeat this. Sometimes, some people, they do lectures and they make it sound like the omega-6 are bad guy. They are bad guy. They're only bad guy if you have an imbalance between the 6 and the 3. You need both of them, okay? Then you want to be eating a whole food diet, best you can. Eat fruits and vegetables. Staying away from those trans fatty acid. Trying to stay away from medication the best you can. Anything that has to do with pain, right? Trying to stay away from that. And then you want to reduce your sugar consumption. If you stop eating sugar, then the pain's going to go away. Maybe you don't need as much as that. Get your spine checked for subluxation and your nervous system, because when you get a chiropractic, if you have a subluxation and you get a chiropractic adjustment, guess what's going to happen? It will inhibit your what? Which system? Your sympathetic nervous system. That's what it does. Right? So when a person's like, my neck hurts, can you crack me? I'm like, sure, I will do that. However, I'll do something else for you that is even better, you might not know about, it's just a side effect. Right? We're going to inhibit your sympathetic nervous system. That's going to make your immune system function better. So as your immune system functions better, right, guess what's going to happen? Maybe you have a chance, whatever bugs that there is out there, your body can overcome it. How's that sound? Mm-hmm. Side effect, right? And then here it says get on a nutrition program and then lose some weight if you need to go towards your ideal body weight. It doesn't matter where you're at right now, you got to move the needle. Any one of you here, doesn't matter who you are, if you think you're not towards, you need to go towards your ideal body weight. Right? That's what you want to work towards. Right? How do you do that? Put more food in your body. Move more. Right? You got to think well, move well, eat well. That's what you need to do for how long? For
Lifetime.
the rest of your life, it's never gonna stop. And then people say, well, Dr. Shanky, how I'm gonna be successful at doing this is you hang out with the people who wants to be like you, right? Some of you here been here 37 times, you could be here and I could be sitting. I don't know why I'm here, right? You could just do this because you've been here many times. When a person is an alcoholic, they go to meetings. Why do they go to meetings? Because, what are the chances a person is going to be dry for the rest of their life after they stop drinking if they don't go to meetings? I don't know. I've never, I've never drank, right? But I'm being told that those people go to meetings for the rest of your life. So here, once a month, we do this thing. It's called the carboholic meetings. So if you're addicted to carb, then you just show up for the meetings, and then you're like, okay, now we're gonna go encourage each other, to try to do better. Because if we do better, then our health's gonna be better. Does that make sense? Right? So as it relates to your heart, this little triangle there is when people don't, their lifestyle is off, then what happens is those organs are gonna start breaking down. When the organ breaks down, then you're gonna become nutritionally deficient, and as a result of that, then, it's the writing is on the wall. It's going to happen, right? And that's the reason why sometimes people are like, people come to those classes and, I always tell them, this is dear to me. Those subjects are dear to me because I've seen this. When my father left that day, right, after the paramedic came to the house, at the time he was 40 years old, he wasn't feeling well, right? They came to the house and they picked him up to go to the hospital on that day. I had, 2 brothers next to me, my 2 sisters are next to me, my mother just turned 35, 5 kids, none of us were teenagers. And when my dad left, not only my father had peripheral neuropathy, but to just top that off, he was also diabetic, but to top that off, when he left that day at the age of 40, right, my dad had a heart attack and I never saw him again. So this thing about chronic illnesses and, having this thing that it's a lifestyle problem. It's not a genetic problem, right? I just have passed my father now 8 years, right? I'm 48 years old, or I'll be 48 in a few months, right? 8 years passed, right? People are like, well, you're going to have what your dad had. I'm like, no, I won't. It was a lifestyle problem. It was not a genetic problem. My father made his choice, right? And I want to encourage every one of you here, and if you're watching, that you're making your choice today. What you're putting in your body, that's a choice. And again, it's not right or wrong. I'm just telling you that every one of you here, with no exception, you have the ability, if you choose to turn that around and to make it better, if you choose to. So I want to encourage you that, whatever next step is for you, maybe you've never had your spine and nervous system checked. You should do that. Maybe you've never been on a nutrition program. You should check that out, right? Matter of fact, when people come to one of our nutrition class, I say, hey, you know what? When people come into their first nutrition evaluation, usually if you're off the street, it's $200. When people come to one of the class, I'm like, hey, $65, you can have the whole first 2 evaluation and report for $65, right? What do you have to lose? Nothing. We're just removing the barriers, because if you didn't care about your health, you wouldn't be here, right? What do you have to lose? You only have to gain. There's only one thing to gain, is your health, right? If you truly care about your health, it's like, okay, what's my next step? Let's do it. What's your next step? Some of you, maybe you're doing all of this, but maybe you're doing it at 50%. Maybe what's your next step? So I just want to encourage you, by the time you leave tonight, before I answer some question, I want to encourage you to be thinking right now, to write it down, say, what is my next one step for me? That's what's most important. Not for the person next to you, not for your spouse, not for your brothers and sisters, for me, right? The only person that can be in charge of this body that you have is you, right? So, I want to say thank you for being here tonight. Hopefully I didn't speak too long. You got something out of this. And then what I'm going to do now is, Nanette's going to be the first one I'm going to answer her question, because she raised her hand and then she thought I forget about her, but I did not. And we're going to answer some questions, and then if you guys don't want to stay for the question, you can just go home. Okay? We're good? You guys are good? Did you learn 1 or 2 things?